This is ultrasound study of a 55 years old female with the history of sudden pain in the abdomen with swelling of the abdomen and protuberant abdomen, and has been referred for ultrasound to rule out any pathology, abdominal pathology. But while scanning, what I am seeing is that in a postmenopausal uterus, in a patient aged 55 years, I see a uterus. This is a uterus with smooth endometrial canal, no calcification seen in this area. Now this is the posterior myometrium in longitudinal section, this is the fundal region, and this is the anterior myometrium. Similarly, now this band of white tissue is the myometrium, this one, and this is the uterus, the myometrium. In the central area where the endometrial canal is, we see an approximately measuring 4.4 centimeter into 2.2 centimeter into 3.4 centimeter echogenic area with internal cystic areas, tiny cystic areas, multiple. So this is an endometrial mass. This is an endometrial mass, whereas this is the area within this circle, dotted lines, is the endometrial canal. Now you can see that it is dilated up to 34 millimeter, the endometrial canal, because of this solid mass, as no shadowing is seen posteriorly, and there are multiple small cystic areas of variable size seen throughout the mass. This is a small one at the periphery, and these are the central ones. Now there is no calcification seen in this mass, and is well demarcated. Its outer surface is well demarcated. See now the outer surface. This is the outer surface, well demarcated, solid endometrial mass with cystic areas, tiny, very small, tiny cystic areas to a little bigger one, with no posterior wall acoustic enhancement, no calcification. However, is the uterus in transverse section. This is the transverse section of the uterus. Is surrounded by a fluid. This is the fluid. All of this is fluid. This is the longitudinal section, and here you see this is all fluid. This is the urinary bladder. Now I'm going to show you in real time. This is the transverse section, and the uterus being seen in transverse section shows you central solid echogenic area with multiple tiny cystic areas surrounded by myometrium and ascites. This is ascitic fluid. This is all ascitic. This black here. Now this is the longitudinal section of the uterus. Now for postmenopausal uterus, the appearance of the myometrium is unusual to be without calcifications, and the size of the uterus is with the pressure of the ascitic fluid, at times it becomes difficult to get it from transabdominal ultrasound. However, the size of the uterus is 8.8 centimeter in length and 4.8 centimeter in anterior-posterior diameter. So the uterus is definitely given the age of the patient is alive, being postmenopausal. This is the round ligament. This is the other round ligament. This is the ovary. This is the ovary. This is the round ligament. Right ovary is seen with fluid. This is all fluid. This is the uterus. This is the mass I am talking about, and these are the tiny cystic areas within it. Now, in fact, this ascites is due to this solid echogenic mass with internal tiny cystic areas. This ascitic fluid, because the ascitic fluid is seen in anterior to the liver, surrounds the anterior surface of the liver, and if you see that the outer surface of the liver is smooth, it is not a cirrhotic liver, rather the echogenicity or echo-brightness of the liver has gone down significantly. The reason being that you can see these tiny, small, tubular structures that are the minor portal vein radicals, which are normally not seen in normal liver. So this is the status of the liver. This is the portal vein. This is the kidney, and you can see these bright areas are all in fact the representative of minor portal vein radicals. This is the gallbladder. This is the right hemidiaphragm. No fluid seen and no pleural appearance seen. Now this is the left lobe of the liver in transverse section. So here we are seeing the left lobe of the liver in transverse section, and here you can see that the minor portal vein radicals are very prominent, unusually prominent. And this is seen in toxic liver or congestive liver. Now this is the supreme, surrounded by fluid. This is the left hemidiaphragm. This is the supreme. This is the fluid, and fluid can be seen in both paracolic gutters as well. This is the left one with bowel segments floating in it. This one. These are the bowels. This is the fluid on the left side in the paracolic gutter, and here. This is the fluid in the right paracolic gutter with bowel segments seen within, floating within it. There is no periaortic gland adenopathy. The pancreas is normal. This band of tissue is the pancreas. This is the splenic vein, the aorta, the gallbladder in transverse section. So this is a case of malignant ascites due to a mass in the endometrial canal in a 55-year postmenopausal female. Thank you.